Hi, this is Dr. Howard Marshall of New York City, and we have just finished the discussion of non-surgical treatment of periodontal disease, and now we're going to discuss the surgical approach. The surgical approach is used when scaling and root planing and new good hygiene practices have not completely eliminated the periodontal condition. Usually still present are bony defects and deeper pockets that are deeper than 4 millimeters, and they will require a surgical approach to completely eliminate and heal the gums so that you will not have recurrence of the gum disease. Now, in this presentation, at this point, we're going to discuss the surgical approach. What we do when we find that there are still defects left in the bone after the first phase of root planing, scaling, hygiene instruction, and irrigation. We use an approach called flap surgery where the gum is lifted to allow us to, this is by the way done under anesthesia. You don't feel anything. And we lift the gum up to get us to the abscess tissue and the bone crest in the bony pockets. We remove any subgingival tartar on the roots that were not visible or accessible to the hygienist, dentist, or periodontist when the roots were root planed. Now we have direct vision, direct access, and we can clearly remove any tartar on the roots. Then we create the proper bone contours so that the gum after healing will be correctly shaped. In certain defects, we add bone, called bone grafting, using a collagen membrane over that bone to get bone regeneration. And in certain instances where the teeth are hopeless, we use extraction of the teeth and socket grafting. Sometimes we will actually place an implant in the socket at that time. If you have this type of surgery, what can you expect just before your surgery, during your surgery, after your surgery? Well, before the surgery, the mouth was prepared for the few weeks prior to it with scaling and root planing and hygiene instruction. You then would be given normally an antibiotic at least 2 days before your surgical visit, as well as being asked to rinse twice a day with chlorhexidine. This is to clean the mouth before the surgery. At the time of surgery, you'll be numbed with local anesthesia. You will not feel any of the surgery procedures. If you are extremely anxious, let the dentist or periodontist know about it. And you can be given a sedative tablet 1 hour before your procedure to help relax you. When the surgery is finished and the gums are resutured in position, they'll usually be covered with a periodontal little bandage called PAC. And that looks like a little piece of clay at the gum edge. We call it PAC. Very often, there may be a little bit of swelling over the first few days following the surgery. Most surgeons will give you prescriptions for pain pills. Pain is most common only the first day as anesthesia wears off. And usually it's just the first few hours, but you could have pain for a few days. The pills that you're given will help if it's a moderate to severe pain. If it's mild, something like Advil or Tylenol will be fine. What should you expect over the next 2 weeks from the surgical day? Possibly some swelling, possibly some pain. Usually the swelling and pain is certainly gone by the end of the first week. At the end of the first or second week, the PAC will be removed, sutures removed, and at that point, your hygiene is reviewed again. What else should you expect? Initially, it's very common to have sensitivity, particularly to cold, on the roots of the teeth. That will go away. It may take several months. It can go away faster if you use Sensodyne toothpaste and rub it into the roots of the teeth that are now exposed. You can rub it in with the brush on the lingual side, the tongue side, and on the cheek side. by putting the paste on the brush, dry brush, just with the paste, no water. And in between the teeth, you can put some toothpaste, Sensodyne toothpaste, and just rub that toothpaste into the roots with a plastic little interdental pick or a wooden toothpick, and just rub that material onto the sides of the roots. That helps reduce sensitivity faster. You're going to have some spacing between the teeth. That's expected. You're going to regrow some of the gum between the teeth, and those spaces will get smaller, but that's going to take several months, anywhere from 3 to 5 months, before the space is finally settled in as to what will be the ultimate space. You also want to review your hygiene with the hygienist to make sure that you're able to keep plaque off. You want to make sure you're brushing properly, and you may again want to use a water pick or a similar irrigating device under low pressure to help keep your mouth clean. Can you prevent recurrence? Absolutely. And what are some of the reasons for failure? Well, the most common reason is poor oral hygiene. The patient stops doing what they were taught, or failure to come back every 3 months and have your teeth cleaned, and if you're starting to break down, have that reattended to. And if your hygiene is slipping, get taught again where you're slipping and how to correct it. Those are the reasons for failure: bad hygiene and dropping out of treatment, or dropping out of the maintenance part of the treatment, the recalls. When is mouth reconstruction done? Well, if you have a moderate to advanced case where you're missing teeth, you've got a lot of root exposed, you've got looseness of the teeth, that's where we're going to have to rebuild your mouth, replacing missing teeth, stabilizing and tightening loose teeth. And also, if you have an overclosed bite because you lost back teeth, the bite has to be reestablished at the right height. We call that the right vertical, so that the bite is correctly rebuilt, and then your mouth is rebuilt by the dental team so that you can chew at the correct level for your mouth musculature. Now, usually a team is involved in this type of rebuilding. The team is usually the periodontist, the general dentist, or the prosthodontist, and very often a root canal specialist called an endodontist. So the conclusion is that keeping the results of your new healthy mouth is possible if you go to the office every 3 months for periodontal maintenance, and if you're doing the correct hygiene at home. In addition, full mouth x-rays should be taken about once a year to compare with the x-rays from the start of when your treatment began, and to compare the x-rays yearly to make sure that bone levels are staying at the same height. Now, there are some new developments in our field today, most important of which is an ability to control the recurrence or non-recurrence of periodontal disease. Oragenics is a company in Florida that you can find on the web, and they are supposedly marketing in the largest pharmacies these days. And they have some products that can be used at a dental office in a prophylaxis paste that the hygienist would apply, and that helps keep the healthy bacteria there, and it helps knock out the bad bacteria. And in addition to the hygiene visit, you have to buy wafers either at the dental office or at the pharmacy, and they're like a mint, and you just take one a day, and they will continue to seed out the healthy bacteria into your mouth at the gum line and keep the bad bacteria repressed so that they don't regrow. That's a very new, important development in the periodontal field. Well, I hope you've enjoyed this series of educational information regarding diagnosis, recognition, and treatment of gum disease, periodontal disease, and the advanced situation where you need mouth reconstruction together with periodontal treatment. So it's Dr. Howard Marshall, New York City, signing off. Hope this has been of help.